Now, I would like to invite our Director General of Health, Tan Sri Datuk Sri Hadi Nur Hisham bin Abdullah, to give his speech and to officiate this meeting.
Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi taala wabarakatuh. Good morning. Salam keluarga Malaysia. Yang Besar Dr. Gita Kandavelu, President of the Malaysian Pediatric Cardiac Society. Yang Besar Dr. Su Kok Wai, Organizing Chairperson. Yang Besar Dr. Khairul Anwar Abdul Aziz, Scientific Chairperson. The Organizing Committee members, distinguished speakers, delegates, and participants from worldwide. With great pleasure, I welcome you to the 13th Malaysian Pediatric Cardiac Society Annual Scientific Meeting. This is the second virtual conference that the Malaysian Pediatric Cardiac Society have organized since the COVID-19 pandemic. Before I begin, I would like to congratulate the conference organizing committee and the scientific committee members who have risen to the challenge to conduct this conference during this COVID-19 pandemic, even as we are transitioning to the endemicity. This virtual platform brings in many local and international distinguished speakers, which may not have been possible otherwise. I want to thank the Malaysian Pediatric Cardiac Society for inviting me to join this conference and giving me the opportunity and honor to officiate. This year's MPCS conference theme is A Journey from Fetus to Adulthood, which portrays the complexity and the breadth of pediatric cardiology services today and highlights the multidisciplinary approach required for managing these patients. Ladies and gentlemen, infants and children with cardiac diseases often require the immediate care of pediatric cardiologists and general pediatricians. If they are severely unwell, the expertise of neonatologists or pediatric intensivists is needed. For those who require cardiac interventions, a tertiary center with a multidisciplinary team, including pediatric cardiologists, pediatric cardiac intensivists, pediatric cardiothoracic surgeons, and pediatric cardiothoracic anesthesiologists will be required. The scope of the pediatric cardiology goes beyond patients of the pediatric age group. It includes yet to be born fetus with cardiac diseases managed by pediatric cardiologists, alongside obstetricians extending to adulthood who require co-management by both adult and pediatric cardiologists. According to the statistics by the Ministry of Health, the incidence of congenital heart disease in Malaysia is around 1 in every 100 babies. With Malaysia's live birth averaging about 500,000 per year, an estimated 5,000 new babies are born with congenital heart disease each year, bringing around 14 new cases every day. Therefore, it is estimated that roughly 60% of these patients will eventually require cardiac intervention, either a transcatheter procedure or surgery. With the advent of the COVID-19 pandemic, we also seeing a rise in a novel acquired pediatric cardiac diseases such as multisystem inflammatory syndrome in children and its related myocarditis, Kawasaki-like complications. Ladies and gentlemen, the pediatric cardiac services in Malaysia have come a long way since their inception. The first country's first open heart surgery was carried out at the Kuala Lumpur University Hospital way back in 1975, then by Hospital Kuala Lumpur in 1982. The pioneering team in the Hospital Kuala Lumpur continued to perform many successful surgeries. Subsequently, it moved to the National Heart Institute, better known as Institute Jantung Negara or IJN, in August 1992. Since its inception, IJN has spearheaded Malaysia's cardiac services and established itself as an international center of excellence for pediatric cardiology, making many advances in the field. IJN has also dedicated itself to training a future generation of doctors. I believe many of you can trace your roots there. Since then, we have seen continuous growth in our pediatric cardiac services. In 1994, Hospital Pulau Pinang was founded as the first cardiac center outside Klang Valley. Today, the Ministry of Health is proud to offer 10 pediatric cardiac centers where 2 tertiary cardiac centers perform pediatric cardiac surgeries. That is Hospital Sedang and Hospital Pulau Pinang. Hospital Sedang offers even complex neonatal cardiac surgeries. Additionally, 3 universities hospitals complement us with pediatric cardiac services, namely Hospital Universitas Sains Malaysia, Hospital Pengajar Universiti Putra Malaysia, and Hospital Pusat Perubatan Universiti Malaya. We are therefore supported by our colleagues in the private sector with 2 major private centers offering advanced pediatric cardiac and surgical services, namely Gleneagle Medical Center in Kuala Lumpur and Penang. There is excellent cooperation and partnership between the different sectors within the fraternity. This was amplified during the peak of the COVID-19 pandemic last year when Malaysia's public healthcare system was severely stressed. The Ministry of Health's 2 major cardiac centers, Hospital Sedang and Hospital Pulau Pinang, had to be converted to full COVID-19 hospitals to cope with the mass surge in cases. All cardiac services had to be halted, hence an emergency meeting was held between all the sectors including IJN, Ministry of Health, universities and private centers where a contingency plan was laid out. Critically ill patients were outsourced and their surgery procedures were performed with minimal delays. Today, our cardiothoracic surgical teams have offered complex surgeries to our patients, including complex neonatal congenital heart diseases such as transposition of the great arteries, interrupted aortic arch, truncus arteriosus, and many more. Our ICUs offer state-of-the-art facilities and are equipped to care for the critically ill cardiac patients, providing the highest level of life support in extracorporeal membrane oxygenation. Our cardiologists can provide the full spectrum of cardiac services, including but not limited to echocardiography, electrocardiography, Holter monitoring, cardiac CT scan and MRI, and complex transcatheter interventional procedures, including PDA stenting, transcatheter pulmonary valve replacement, and extreme prematurity PDA occlusions. The Ministry of Health recognizes the need for the health reform to be the future-proof, transcending change in the political landscape. As such, we are currently putting forth a white paper on health system reformation of service delivery, financing, governance, and organization for the next 15 years. We recognize the chronic underinvestment in health, and this will be addressed within the white paper to ensure a sustainable health system that meets all public health needs. While there are no quick fixes, the Ministry of Health believes that the health white paper, which is being drafted, plays a critical starting point in Malaysia's health system transformation. Through this health white paper, the Ministry of Health will ensure that Malaysia's health system is resilient and can fulfill the nation's evolving health needs. As the Director General of Health, I will continue to ensure that our health system will remain resilient. By working collaboratively with all stakeholders, the whole of government, whole of society approach as seen in the pandemic response has shown that we are stronger when we work together for a common purpose. Ladies and gentlemen, conferences like this will allow the participants to discuss new and updated evidence-based practice and learn about valuable experiences shared by our global experts when managing patients during and after the pandemic. I wish each participant an enjoyable and fruitful conference. I hope exchanging ideas and experiences from this conference will strengthen your leadership role and your clinical practice. More importantly, I hope this conference will allow networking and foster camaraderie amongst the fraternities. On that note, it gives me great pleasure to officiate the MPCS Annual Scientific Meeting 2022, and I thank you.